Welcome back, students. And today we will be dealing about the topic dysphagia. So, what is dysphagia? It is difficulty in swallowing anything. So, that is called dysphagia. And you should see that whether the dysphagia will be having the cough, choking, nasal regurgitation. Nasal regurgitation, food coming from the nose. If they are present, then it may be oropharyngeal dysphagia. Okay, in the dysphagia, if there is a presence of cough, choking, and nasal regurgitation, it is oropharyngeal dysphagia. If there is no this symptom or this association, then it can be esophageal dysphagia. Okay, this can be esophageal dysphagia too. So that is of two types again. Dysphagia of both solids and liquids are happening simultaneously, then it can be motility disorder. Okay, when you're having the dysphagia, both solids and liquids are regurgitating, or there is dysphagia for both solids and liquids, then it is because of motility disorder. But if there is a dysphagia progressing from solid to liquid, first you'll be having with the solid, then to the liquid, then it can be because of the mechanical obstruction. So in the motility disorder, it can be initially tested by barium swallow, and but the most accurate test will be manometry, by this scanning technology. And in the mechanical obstruction, best initial test is through the barium swallow. Again, you are advised to swallow the barium, then the scanning can be done. But most accurate test is by endoscopy and taking the biopsy. This is the major test which can be done to confirm this condition. And let's see about motility disorder. Okay, some of the conditions under the motility disorder coming for the dysphagia. The first one is achalasia. So what is achalasia? It is less unable to relax due to degeneration of myenteric flexus. There are nerve flexus, and because of this degeneration, there will be a reduced, or there will be unable to relax the muscle of esophagia. There is second one, scleroderma, where immobility will be reduced, and there will be history of scleroderma to the patient. And there are also something called as diffused esophageal spasm. Okay, there will be spasm in the esophagia too. So in case of achalasia, initially you should do the test of barium swallow, where you can see the bird beak appearance in the x-ray. Okay, bird beak x-ray is present, then it is called as achalasia. Okay, that is confirmed. But confirmatory test again will be done through the manometry, that is through the gold standard method. So if there is a presence of achalasia, what you will do? The treatment is, initially there is to be pneumatic dilation and myotomy can be done. The hole should be made for the muscle, and dilatation can be done, pneumatic dilatation. And second line, you can give botulinum toxin injection can be given to the area. Botulinum toxin, which are highly nowadays used in the beauticians. Okay. And third line will be CCG and nitrates. These are the drugs or the medicines can be given to this patient. Coming to the scleroderma, the confirmatory test will be done through the motility studies. And if there is a presence of scleroderma, you can treat with the proton pump inhibitor. The example for proton pump inhibitor, you can comment below. And you can also give pro motility drugs like metoclopramide. Okay, this is the drug you can give for the motility conditions. Next is about the esophageal spasm. Here, dysphagia, that is difficulty in swallowing, also will be associated with chest pain that will mimic like myocardial infarction. You will feel like it is a myocardial infarction, but yeah, it is also relieved by the nitrate medications. Any nitrate medication, if you take, it will be relieved. And along with that, drinking cold liquids and emotional factor also will increase this esophageal spasm. So by the initial test, you can do through the barium swallow. Okay, here it will, the X-ray will be looking like corkscrew, and confirmatory test again can be done through the manometry. So manometry is the major confirmatory test can be used in the dysphagia to identify the conditions. So what is the treatment? Here treatment you can give is calcium channel blocker, or nitrates also can be given. So the example for calcium channel blocker, any dipins, amlodipine, epidipine, this can be given. Other examples you can refer, or you can just comment below. So that is about the first condition, that is motility disorder. And coming to the mechanical obstruction, okay, there is an obstruction on the passage of the esophagus, and you can see it by through any scopy, like endoscopy. And after endoscopy, you can also take out the tissues for the biopsy. So there can be esophageal cancer, like upper two-third of the esophagus will be having the squamous cell carcinoma, or lower one-third can be having the adenocarcinoma. But how you will do the test? Again, it is a barium swallow for the initial test. And most accurate test, again I told, it is endoscopy and biopsy. You will do the endoscopy and remove the tissue and send for the biopsy. And in the CT scan, you can see for the metastasis if there is any spread of the cancer cells. And bronchoscopy also can be done just to check that if there is any spread to the lungs. So what is the treatment? You are supposed to do the surgery to remove the cancer cells, and chemotherapy also can be given. And the other condition is esophageal stricture. What is esophageal stricture? It is a constriction, okay, constriction in the esophagus. It is presentation same as cancer caused by the acid. So the initial test, again here barium swallow, and accurate test is, confirmatory test is endoscopy and biopsy. So what is the treatment? Again here you can use surgical dilation, since it is a constriction in an area, so you can do the dilatation with a proton pump inhibitor. Okay, any what proton pump inhibitor, you can just comment below as I told before. Next, there will be rings which are constricting the esophagus, like Chadsky's ring, or webs would be present like Plummer-Svinson ring webs. So this is the major third type, that is rings and webs can be present. Again, what you can do, it is through barium swallow. Since there will be a constriction, again you can do the surgical dilation, and again can treat it with PVS. If there is a PVS, again add the iron tablet. Okay. So the major thing about the oropharyngeal dysphagia, can be done, or it can happen through the stroke, okay, or multiple sclerosis, again neurological diseases, Parkinson's disease. Why Parkinson disease comes, just, or what is the deficiency, what deficiency causes the Parkinson disease, you just comment below. There can be a condition myasthenia gravis, again the neurological disorder. There can be a tumor or Zensker diverticulum. This can be also present in the oropharyngeal dysphagia. So here weakening and outpocketing of cricopharyngeus muscles can be seen. Okay, when you test, when you scan or X-ray can be done, then the muscle which are present around the thyroid, or near to the trachea, cricopharyngeal muscle. So there can be a weakening and outpocketing, it can come outside, that can be seen. There can be condition like halitosis, there can be a bad smell coming, usually present in the diabetes patient, but here can also it present. And dirty pillow in morning regurgitated food. So you're sleeping and morning when you get up and see the pillow is wet and it is dirty, that is seen as regurgitation. What you can do, you can do the barium swallow just to check out what is the condition. And treatment is surgical resection, you will remove through the surgery. You should know that endoscopies are not are contraindicated here. Why endoscopies are contraindicated? You don't know what patient is having here, because you should do the scanning or x-ray prior to the endoscopy. Okay, that's all about today's topic. I will see you tomorrow. Thank you.